My name is Andrea Carter. I'm from Johaven, Nunavut. I've been living in Ottawa since 2001. I came down for the Nunavut Sivunik program, and I decided to stay after I graduated from the program because there was a lot more resources for me and my son at the time. I've been with Inuit as their social navigator, and my role with them, I try to do cultural activities and programs with clients and patients at Larga or CHIO. I try to use the IQ principles a lot when I'm working with clients or doing my programming. IQ principles is Inuit Kaimayutakangit values we go by. It helps me with by respecting my clients, listening to them, and supporting them with their needs, and just being kind and helpful in any way we can to help our clients we work with. Because a lot of times it's very difficult when you're alone down here, and having that one person being by your side or supporting you, it just makes it a little bit easier being away from home. Having a social navigator for people that come down here, I think it's very important, and we're there to support them in any way possible we can, and try to help where we can, when we can. It makes it a little bit more comfortable having another Inuit beside you when you're on your medical appointments or stuff like that. We usually help clients or patients transportation, or if they need health numbers or stuff like that, we're there to assist them. We do referrals for housing or help assist with housing. We try to do our programs more in cultural perspective. We have cultural programs available like sewing, beading. Sometimes there's traditional tool making. We usually visit or check on them if they're at the hospital. If they need anything, we send kits for children or their escort parents. A lot of times we'll drop off coloring activities or sewing materials for people in the hospital or at Larga, because when the patients leave and they're ready to go home, they stay in the isolation hub, so we take care of those people too. So we try to be where we're needed. If we need translator, we have interpreters and translators that are available, or we do it ourselves if we can. For nutrition, most times we'll have country food available, and we'll distribute it if they ask for it or if we have it. My social navigator position, I work with clients and patients that come down for medical. And I also work with youth that are in group homes that come down from Nunavut. Sometimes I'll do Zoom programs because of COVID. We can't go in and do programs. So sometimes I do programs through video. I'll try to keep it cultural. Sometimes I'll have an elder tell stories, or I'll have an elder come and teach tool making, or have an elder teach sewing. And I try to keep it culturally based because it's so important. Down here, we need to practice and keep our culture. So when I work with patients or clients, I like to try to keep it in that area. The other thing we do also for people, if they need help with eye exams or dental, if they need to see a doctor for any reason or a nurse, we refer them to places they need to go. So we're always trying to assist where we can. I'm a social navigator because I really enjoy working with people. When this position came up, I applied, and because I was thinking of my fellow Inuit, how can I help? How can I assist? And having a background in helping people, I thought it would be a really good position for me, and I really enjoyed so far because I get to interact with fellow Inuit. I get to help them when they need it. And just being by their side for them, especially when they're down here for medical. They do really need that one person or somebody with them, and just showing them that we're here to help and support is really important for me to know that I've helped them out or we're here to help them. Because when you're traveling out of home, a lot of times you're alone, and sometimes you feel you just need to talk to somebody because the situation you're in or the situation you have to deal with, it's always nice to have that one person listening to you and guiding you and supporting you. So I really enjoy what I do today. A lot of people may not understand when you travel out for medical, we're coming from very small communities. We're very isolated. So when you come down to a city for medical, it can be very overwhelming, especially for our elders, because they don't speak English. They don't see busy streets out there. And it can be confusing too. I've traveled alone, like I've experienced traveling on like medical leave myself. So I really feel for these clients and patients when they come down here, because a lot of times they get lonely. Most times they don't have any support or somebody to turn to. And especially if you're at the hospital, long term or short term, you can get very lonely, and it's very overwhelming because you don't know what the doctors are saying sometimes, or a lot of times you can misunderstand because English is not our first language, so a lot of them have a hard time understanding medical terms and stuff like that. Having social navigators down here, we can be very helpful in many ways. We have social navigators with Inukatigit, Tungasubingat Inuit, and Akausivik. So if anybody needs assistance or have any questions, we're always available to connect or reach out or give information if we like what we can help with. we're always more than happy when we get referrals, or we're always more than happy to hear that there's somebody that needs help or assistance. And so, like if one can't make it, there's another social navigator. So we work as a team, try to work as a team together.